All right. Okay, so we're going to get started. Thanks everyone for coming. I know that by the volume and number of emails I've received over the past couple of weeks, people are concerned about the upcoming fall semester and the institutional decision to return to normal in-person instruction. For now, we are doing everything we can in the graduate school to make sure that that return to in-person instruction is as safe as it can be. I think it's our responsibility to help in that endeavor as much as we can, and try to preserve that in-person experience as long and as much as we can. But I think it needs to be said that common sense should prevail, and that's been said a number of times with people I've spoken to. You know, and really keeping in mind what makes sense for our institution. And I know you've probably seen a lot of media reports about other institutions. And unfortunately, those are their institutional decisions. And for right now, our decision as an institution is to go to in-person instruction. So to help minimize the spread of the virus or potential spread of the virus, you know, Gsbs has taken some proactive steps. We have acquired a number of masks from the institution that we can make available to course directors. We have those in our office, and Dolores and Maudrey have put those in individual baggies and numbers of 5, 10, or 20. So based upon, I'm letting people in, based upon the number of students, you can come and grab as many as you need. Or, you know, you always can have, I guess your coordinators could come pick those up at their convenience. We're also installing plexiglass dividers in the larger classrooms, so 209, 309, 409, and 444B. That work order has been submitted, and I had an email exchange with Mike Charlton about getting those done. If you would feel safer in your classroom and would like plexiglass dividers, just let me know as soon as possible, and we can get that ordered. We're also working on language for an email to send out to students, and this will address part of your question, Rita, about masking. That does really push the expectation that masking is expected in classrooms. And so we have to be very careful, as you know, with the wording of things that we say, being a public institution. But there are things we can say that give the students, put out notice that in classrooms masks should be worn. We are also, you know, the other aspect of potential high risk exposure is, you know, so masking. Obviously, if everyone was vaccinated, that would be awesome. But also distance. And fortunately, in the graduate school, you know, a number of over 90% of our courses are 20 students or less. And so that makes distancing in classrooms much easier. There are a handful of courses that are larger than 20. And I think that's where common sense and the judgment of the course director needs to come into play, and happy to have those discussions with course directors if there are issues or concerns about distancing in a classroom. We can always check to see with university scheduling if there's another room available that might accommodate a larger size class. But I do have, and I can share this after this with everyone again about the capacities for COVID. Ultimately, though, there is some flexibility that we have in terms of online virtual teaching. We do have an exemption that's in place from SEC COC until August 31st. So basically the first week of classes are covered. And then after that, we also have some flexibility in that 15% or up to 15% of the contact hours in a course can be virtual, and that class can still be considered in person. So, if you want to figure out the contact hours, times 0.15, and you can get those numbers. And it's about 2 hours of contact for one credit hour class, about 4 for a 2 credit class, and about 7 for a 3 credit class. So there is some flexibility. Ultimately, though, however, let me just say that this is going to be on an honor system. I'm not going around and spot checking classes. And so ultimately, the course director needs to use their judgment and common sense and determine whether a course can be held in person safely or not. The last thing, and I've heard, so of those courses that we have that are still rather larger enrollments, a number of them are seminar and journal club. And I know that, and I've heard a lot from those course directors saying, oh, we did it virtually last year and it worked out fine. It was actually better in some cases. And that's great. That's one thing that COVID was able, and the virtual environment was able to demonstrate, is that we can do those types of things virtually and still have a good experience in those types of classes. However, what I would recommend is that you need to have those discussions at the program level, and you do have some flexibility within a program to have some of the credit hours virtual. And so if that's something that your program wants to continue, you need to have those discussions within the program, and then it needs to go through the proper approval process. If you have a curriculum committee, then COGS, sometimes the COGS is the curriculum committee, and then it would need to go to the Gsbs curriculum assessment, GFC, and so on for approval. And ultimately, we would need to change that designation in course leave. So that, and that would follow the same types of, so for fall 22, and Amber, I know you're on here, please correct me, the deadline would be December 31st. And then for the following spring, it's April sometime. I forget exactly when it is, but I can get those specific dates for those deadlines if you're interested in doing that for those seminar and journal club classes. I've also had questions about, well, what happens if we have an in-person class and we find out that a student is positive? So they come to class on Monday, and on Tuesday they notify the instructor that they tested positive. Well, the first thing they should do is contact Wellness 360. At that point, the same protocols that have been in place since the pandemic and all this started, Wellness 360 would handle any contact tracing. So you might want to consider, if you can, have assigned seating in your class. That way it makes the contact tracing a little easier. They would initiate the contact tracing, and then they would also reach out to anyone that might have a potential high risk exposure at that point. After that, the class could meet normally again, but again, at the discretion and judgment of the course director, you need to reassess, you can reassess. This is a very fluid situation, as you see in the news. Things are changing from day to day. But for now, we're trying to move to an in-person teaching, instruction, delivery. Gsbs is helping, or wants to help make that as safe as possible, and we're doing everything we can. If you still have concerns, happy to discuss those. I see there are some questions. So Rita, did I answer your question about the masking and the social distancing?
Yes, you did.
All right.
Thank you.
Chris, the dividers would be placed at the front. This would be the divider between the lecturer and the students. So we'd place them at the front of the room. So the question about travels canceled. So anyone that, and I know Nikay's on here because we had this discussion the other day as well. Anyone that is coming to the United States has to have a negative COVID test 3 days before they're allowed to enter. At that point, I don't believe there's any quarantine in effect. It is recommended that they test again once they're here, 3 to 5 days afterward. Nikay, am I forgetting anything?
No, you're right, Tim. I think we are seeking guidance from Dr. Mock in terms of our ability to require students to take a second COVID test prior to coming in. They do have to have one before boarding the plane to come in. CDC recommends they do one at 5 days. So we're seeking guidance as to whether we can require that or not. And then if we can, we'll develop a structure for having that, but we are not there yet.
Thanks, Nikay. Dr. Allen asked about marking the classrooms. I don't believe the classrooms will be marked, but you know, it should be easy to figure out the proper distancing. And I believe that, and I don't know if we haven't seen the follow-up to this, but I know that last week there was a question about the classroom cleaning and if that was going to return to what it was previously relative to, I guess they're cleaned every day. Bill asks, if a student refuses to wear a mask, can they be asked to leave the classroom? What is our recourse? So again, once we send out this email to the students, making it clear what the stance of the graduate school is and that masks should be worn in classrooms, the course director has, and we will fully support any decision by the course director at that point. If the student, if you want to ask a student to leave, that is the course director's prerogative. However, another alternative might be to, to avoid making a scene in the class, is to make contact with the student afterward, or make us aware of the student's refusal, and we can handle it. But yes, based on the email that we are going to send out, it is definitely within the purview of the course director to ask the student to leave if they refuse to wear a mask. Rita, again, we're working on that language for that email to send out. Ratna, so if a student refuses to come to class, again, I think the other thing I want to, the graduate school isn't trying to micromanage your course. We do have already attendance policy in place, and then that becomes, again, at the discretion and purview of the course director. If you talk to the student and they provide a reasonable excuse, and then it's up to the course director to decide if they want to count that as an excused absence, which then allows that student to make up that material or not. So, Chris, I mean, I hear you. I've sat through quite a few meetings where this has come up, and there is a process for faculty to request ADA accommodation if they have an existing medical issue that would make them susceptible to getting severe illness with a COVID infection. They can go to HR and request that ADA accommodation. And I did write the name down of the individual in HR. I'm looking to see if I can find it real quick. But Sarah knows it. Sarah, did I see you on here, Sarah?
You do. Her
Oh,
name is
yes.
Danasha Robinson. In HR, there's a very brief form to fill out with documentation from your provider.
I did that earlier this year, and I was told that I actually went through Bonnie Blankmeyer if I was faculty, that was a staff connection.
So I actually spoke with Dr. Blankmeyer because this came up in the School of Nursing, and you are correct that she used to handle it. I confirmed with her again today. For the past 2 years, for faculty, the requests go through HR. I know there's been some confusion with some HR specialists, but Danasha Robinson knows exactly what to do and will get you taken care of.
Thank you.
Thank you, Sarah. Appreciate it.
But
Renee,
Tim, this,
yes.
oh,
Hey,
sorry,
Mike.
Mike. Back to, I think it's Chris Walter's question. You know, if faculty have young children at home under 12 who can't be immunized, and that faculty member is perfectly healthy and has been vaccinated, they still pose a potential risk. I mean, I grant you that it's probably much more minimal being in a classroom than maybe going to HEB. But does HR recognize that as a potential exception? If someone has young children at home and they don't want to expose them and they're having to be in class with 100 students, do you know what the answer there is?
I do not. I
Okay.
can find out though.
Okay.
Unless Sarah, do you know that scenario? Or
No, I don't. I looked at the form and it's pretty similar to what our students fill out for ADA accommodations. And my impression of the form is it's health related. And like I said, you have to have documentation from your provider. So I would just talk to HR
yeah.
and have a discussion with them.
I'll just make one quick comment. ADA accommodations are very individualized. So it's an individual thing. There's not a broad stroke that answers everybody's questions. There's not a one thing fits all. So if you have a request, you should just go make it.
And if I can add one other thing, so the ADA requests for students do still go through Dr. Blankmeyer. If you had a student for some reason that couldn't be in the classroom, route them through Dr. Blankmeyer.
Excellent. And I'm just, I'm waiting. I have Danasha information here and I can't copy it for some reason. But I was going to put her email in the chat. I'll do that when I get a chance. All right. So, Bill, yes, that would be the accommodation. You would be at a remote location, and the students would be in the classroom. That would fulfill the in-person designation for that course. Other questions or comments?
Tim, this is Keith. I just wondering, can you repeat what you just said about the accommodation, the response to Bill? What the accommodation that we're talking about, it has to do with not students, but faculty that have.
Exactly, it would be the faculty accommodation. That is one option, is for the instructor to be remote and Zoom in, and the class, and then the students would be in the classroom watching the presentation remotely.
So if they're in the classroom, then it's not considered, it doesn't score against that percentage of contact hours.
Exactly.
And I have a curiosity question. Are we going to have another one of these meetings with students present? I would really love to know what their attitude is. If we're going to dump them in a classroom together and I'm going to stay home doing it, I mean, I'd be pretty aggravated with me.
So we're kind of waiting to see how this town hall played out. I know that Nikkei has some plans for reaching out to students.
Just so you know, Keith, I met right before this meeting with a group of students, the GSA officers, and asked the same question. They are all virtualed out.
They're all what?
Virtualed out. They do not want to have classes virtually. And this was unanimous in the group that I was speaking to. I will admit it's a small sample size. They said it makes sense for seminar and journal club to be had, but truth be told, when they do seminar or virtual or journal club virtually, they decipher in the first 5 minutes if they have an interest in the topic, and if they don't, they go off and do other things. And one young man indicated in that conversation just now that he has retained nothing from his virtual courses in his first year. So they are, as long as they're social distance and everyone has masks, they are more than comfortable being back in the classroom.
I wonder why I'm feeling so much less comfortable than they are. I don't really get it, but one other general comment about the graduate school's approach to all of this, and that, you know, it's nice to say that this would be, and Tim, you said this numerous times, that there are certain decisions that need to be made at the course director level, course director discretion, course director, you know, whatever, and that you're not going to be running around being the virtual police or anything like that. And I appreciate that. And we all want to have some sort of control over our own courses, but there is also a downside to having it not be consistent policy across the graduate school, which is that it comes down to a personal decision by the course director versus the class as to how things are run. And it leaves us with no option to say, well, this is the graduate school's decision that we do it this way. And whether it's one way or the other, it's just, if we're all doing it differently, it just seems like it's going to lead to a lot of confusion for the students and for the faculty.
I think our stance, Keith, is that we want to see in-person teaching in the fall.
And so you're not suggesting that we should encourage any kind of virtual anything.
I think that if you can meet safely in person, then that's the way instruction delivery should take place.
See, there's the catch. I mean, how do we measure safety?
So is everybody masked? Can you distance? I mean, that you know, the masking, the distance, and the exposure time are the three variables that are utilized to determine a high risk exposure.
Mm-hmm.
You know, the duration time is something, you know, that's preordained,
So
as it
Tim,
were.
sorry, this
Okay.
is Renee.
Hey,
Can I
Renee.
ask you something?
Yes, you
Um,
can.
So the School of Medicine is like in person with like all the first year medical students, and we've been that way since the last week of July. Is there anyone you can talk to there to see, because there's no social distancing? You know, most of the students are masked, but I'm just curious if you can find out, because I can't find out if there have been any infections, since by now we should probably know.
You know, we met last Thursday with all the associate deans, and there was no mention of infections that I can remember in the classroom setting.
Okay.
Nikkei, is that accurate? I mean, it seems like that would have been front and center. I don't remember.
There was no mention of it. If you look at the COVID website, our detailed oriented Mary Bradley tracks this. And apparently there have been 28, I think it was a number she said the last time, infection, but we have no idea where those are. We just know that 28 students have been infected.
Is it students or is it faculty, staff, and students?
I think she broke it down on the number of students. It was more faculty and staff than students. And I think the number was 28.
Okay.
Because somebody should pay attention to that because, you know, that's like so many students and there's no social distancing. They're mostly masked, but there are about 10 students who will not wear a mask. So, you know.
I am pretty sure, Renee, that knowing Josh the way I do, that they are paying attention. Whether
Okay.
they share that information is another story,
I
but
think it
I
would
am
be helpful.
absolutely sure they
It would be
are.
helpful to everyone if they would share that information.
I completely agree.
Okay.
This is Pam Larson, and I wanted to second that because we have the DS1s and, you know, when they're coming in from other places, at least for a few weeks, I'll worry a little more. And we had an example on Monday, excuse me, of a student who was in class and came up to me as a course director and said, I might miss tomorrow if my COVID test comes back positive. Right. And so I'm going to make a request when you send your letter to the students, if they believe they've had an exposure such that they'd be taking a test, that they make arrangements with the course director to not be in class until they know. But I also agree with Renee that if you guys know about a positive, if there's I have a problem because it's a health privacy issue. So I'm not sure how you could do this, but to at least let us know there was a positive case in our room.
All right. I'll check and see if we can get more detailed information about if there are infections in the classroom
you.
setting and where they are.
I appreciate that because we can do the assigned seatings like you recommended for contact tracing. We just wouldn't know when to tell somebody something or exactly how to tell them. So I'd appreciate help with that.
Tim, this is Rita. You probably said this already and I must have missed it, but I just wanted to know if you were going to, this email that you're planning on sending to the students, will the course directors also get a copy of that so that we know
Yes.
what the language was? Okay.
Yes, yes, ma'am.
Oh, this is Jeff. We do run across HIPAA compliance or private medical information compliance and somebody testing. So what I'm planning on doing is telling any student, if they don't want to show up for class, they can go over Zoom and we'll do a blended thing. And so that doesn't put any onus on them or whether they're sick or it's just inconvenient for them or they have a sick kid that day or whatever. And I'm just going to ask them to give me as much notice as they can. So on that day, I can set up the Zoom as well as teach a class.
I think that's a good example of course director purview and judgment and making decisions about your class. And Bill, I'm trying my best to answer your questions, but I think that accommodation is determined by the compliance officer, and so I think that you have the ability, and Nikkei, this is more your world than mine, but so please tell me to be quiet if I'm. You have the ability to not challenge, but ask about a specific accommodation and see if there's another way to do it.
The concern that I have is just that to set up, like Jeff mentioned, the blended thing, which would work, except in the format of the IBMS 5000, it would be a nightmare for me to try to set that up, and I honestly don't have the time. So if the ADA office were to require me to do that, it's just not going to happen.
That's why I think a reasonable compromise would be recording those and making the content available at a later time. I mean,
Sure, that's exactly what we do record.
Yeah.
That's fine, except
Yeah.
for the small group discussions, which are not. And there's not any way to do that that I can see that would be reasonable. But I'm just, the way you presented it is that they will decide what the accommodation is. If they decide that it's going to be, we need a blended solution, I'd like to be able to say, well, that's really not practical. Can we change that? Or do I just have to live with whatever they decide?
I'll just make two comments here, Bill. One is the ADA accommodation says something that is reasonable. So one has to decide what is reasonable. And then it is the onus is really on the graduate school to set up that accommodation if it's determined that it's reasonable.
That's all I need to know. That sounds perfectly fine. Not a problem. I'd love to be able to do that, to have a blended or a biphasic kind of thing. But for some of the parts of the course, it just doesn't work.
Okay.
thanks, Nikkei.
Sorry, Tim, can I ask a question? So I know that we can't mandate, that students be vaccinated, or maybe we can, or maybe we can't tell them that they can wear a mask. I guess we have to wait to find out. But Jim kind of had brought up something. Can we tell the students that if they're not vaccinated, then they need to do some kind of regular testing? Is that something that we can do, like other schools are doing?
I have not heard that specific instruction at the institutional level.
Hey, Tim, I know I've seen some news items recently that at UT Austin, I think they're requiring testing or certain things. Why is there a difference among the UT system institutions with respect to what's allowed and what's not? I think that's kind of confused. It's making it difficult for everybody because we read the newspaper and we see what's going on elsewhere and we don't see it necessarily reflected here, and we just don't. It's kind of hard to understand that.
I agree.
Okay, well, I'm glad that we're in good company. Is that something that you've taken up with Dr. Mock and the higher leadership? Because I think it's beginning to look like our institution is a little more rigid or something than other institutions in the system.
So I have had a few discussions with Dr. Mock over the past few days. Yes, I have. And Chris, during one of those discussions with Jacqueline, she did mention that she had a scheduled discussion with COC this afternoon, and I was hoping I would hear something, but having not heard anything, there was, to my understanding, there was not an extension submitted, or COC stated they weren't going to review extension requests for this at this time. Yeah, and David, I saw that as well, and I shared that with the registrar, and I asked if there were any similar discussions taking place on our campus, and the response was not at this time. We have not received any guidance.
So just out of curiosity, Tim, how do they do that? Still meeting this 15% requirement for virtual. Is it just on contact hours for those courses then? And they're simply burning through that 15% in the first 3 weeks and hoping that the surge sides enough that after there won't be a need for this?
That's what I would assume.
Does SACS COC have some kind of, do they sanction the institution if we don't do what they tell us? Or I'm just curious I mean, are they really going to do this? Are they really going to sanction someone for trying to be flexible at the local level when they're sitting on some committee in Atlanta or wherever it is, don't know our situation?
So that's why I think we need to do what is in the best interest for our students and faculty and staff at our institution. And worst case scenario, if an audit took place, and again, I'm not going to go around and audit, I'm not going to go around and spot check. This is going to be an honor system. But if they did and a course turned out to have 25% virtual classes instead of the 15%, that would be a finding. They could potentially put us on probation. But I can't speak for SACS COC, but that would be pretty messed up.
I have a question in that regard. You said that it can be virtual through August. Do those lectures count in the 15%?
I'm going to say no.
Good. That gives us a little extra leeway.
Yes, ma'am.
Yay, administrative discretion as well as instructor discretion. I love it.
I hope we've addressed and answered some questions. I know that probably not satisfactorily to everyone's liking, but again, the graduate school is here to help in any way we can. And if there are specific instances or circumstances where you want guidance or to run an idea by me, I'm happy to do that. Just let me know. Again, the other thing is if we do have the masks in our office, and we can always get more if you need them. We are putting those dividers up in those larger classrooms, but if you would like one specifically for the classroom you're teaching in, let me know and we can get that work order submitted. Again, we're just here to help as much as we can. Ratna.
Tim, if we have 90% of the students willing to come to the class, can we allow the other 10% online considered it's in class?
So that would be a hybrid blended class.
Yes. So it won't count for the accreditation?
So again, according to the guidelines, you could do that for 15% of the contact hours in the first week as well. So that's 3, maybe 4 meetings. You could do that.
Okay, thank you.
You're welcome. Hey, Jessica.
Question that's on topic, off topic. Orientation and program orientations, does that count as a programmatic activity that needs to be virtual or suspended for 60 days, or does that count as educational? And will the GSBS orientation be in person, virtual, or in between?
I will turn that over to the good Dr. Blake.
Thanks so much, Tim. Appreciate that. As of right now, Jessica, GSBS orientation is in person for half a day and virtual for the second half of the day. That could change. We're not set in stone at this point, where it's still a moving target for us. I believe that program orientation happens before classes start. So you can do that any way you choose, doesn't matter.
Okay, thank you.
Mhm.
You know, I think, you know, following CDC guidance about masking, regardless of vaccination status, you know, vaccinated, they recommend masks indoors. Unvaccinated, mask in all settings. Anything else? Okay, if anything comes up, you know how to get in touch with me. Happy to help. Thanks for your time and your collegiality, much appreciated. And here to help. Have a good evening.
Thank you, Tim.
Thank you.
Thanks, Tim.
You're
Thank you
welcome.
very much, Tim.
Thank
Thanks
you.
a lot.
You're welcome. Have a good
Thank you,
night.
Tim.
You're welcome. Bye, Renee.